The biceps muscle is a fusiform complex formed from two heads, the long head and the short head. We will begin with the long head. The long head has been described as having 5 attachments. The 3 main attachments are the direct arm, the anterior arm, and the lateral aporonic expansion. The direct arm inserts directly on to the posterior and lateral aspect of the fibular head. The anterior arm inserts partway onto the fibular head, courses distally over the fibular collateral ligament, and then continues on to the anterior compartment of the leg. The lateral aporonic expansion runs anteriorly off the distal aspect of the long head, inserting on to the posterior aspect of the fibular collateral ligament. 2 other commonly described attachments are the reflected arm, which connects the long head to the iliotibial band, as well as the anterior aporonic expansion, which is basically the continuation of the anterior arm onto the anterior compartment of the leg. Notice the peroneal nerve running just posterior and distal to the long head of the biceps. Let's now go to the dissection. The long head of the biceps runs the entire length of the lateral aspect of the thigh, coursing just posterior to the iliotibial band. The first main attachment is the direct arm. The direct arm inserts directly onto the fibular head, highlighted in blue. The next main component is the anterior arm. The anterior arm inserts partway onto the fibular head, runs over the FCL, shown here, and then continues on to the anterior compartment of the leg. The next main component is the lateral aporonic expansion. The lateral aporonic expansion is a thin, wispy layer that runs towards and inserts on the posterior aspect of the fibular collateral ligament. A window is shown here through the lateral aporonic expansion. The 2 other commonly described attachments are the reflected arm and the anterior aporonic expansion. The reflected arm runs from the long head to the iliotibial band, which has been opened to show the short head of the biceps. The anterior aporonic expansion is the continuation of the anterior arm, shown here, onto the anterior compartment of the leg. Notice again the peroneal nerve just posterior and distal to the biceps complex.